What's going on, guys? It's Marlon Conaway, aka Marlon the Money Coach, and I want to bring you a New Year Medicare Minute, man. First of all, Happy New Year to everybody. Hope everyone had a great Christmas holiday. And as we transition into the new year, just want to drop you a few quick nuggets on what to expect moving forward. Now that the AEP is over, the annual election period is over, and we're moving into January 2021. So, first of all, as the year gets started, we're talking January 1st moving forward. A couple of things you want to do right away is you want to go out and see your providers ASAP, your doctors, specialists. Go ahead and start booking your appointments. Get to the first of the list because usually the beginning of the year is very, very, very busy. And so you want to get out there, get to your doctors. If you're on an HMO program, get all your referrals back in place for the first part of 2021. Go out there, get your medications filled, get your prescriptions filled, get your prescriptions renewed, and so that you're on stock with medications. Hopefully you guys are on stock anyway, but I know how it is sometimes with the holidays, especially in the corona environment. Sometimes we can't get out and about as much as we have in the past. One good thing that you can do too is look into doing your mail order pharmacy. It'd be a great opportunity to look at that for 2021. So get out and start using your programs, get out and start doing your appointments, filling your prescriptions, and kind of get a gauge as far as your cost sharing expenses, all right? And make sure that it's up to your expectations for what you signed up for 2021. So if you're out there moving around and you start to notice some different things, and the reason why I want you to go out there early is to be able to catch any glitches or surprises. So one example is if you go to a provider that you're used to going to, and they say, well, hey, as of January 1, we're no longer taking this insurance. You want to catch that early, okay? If you're picking up medications and the cost of that medication is a lot higher than what you expected or what you paid in the past, you want to find that out early. So let's get out moving early, because once AEP is over, once the annual enrollment period is over, you may not have an opportunity to switch again into the next enrollment season. So for right now, what you should have received so far are your cards for 2021. If you have not received your card, you want to reach out to your provider. Just find your old 2020 card, all right? And on the back or the front, it should have the 1-800 number to your customer service department. And just give them a quick buzz and say, hey, I have not received my 2021 card yet. Could you please send me one ASAP? Also, make sure your addresses are up to date, or if you use a P.O. box or a different mailing address, make sure those are up to date on file. Also, you should have received your enrollment packets and documents in the mail. You're going to get a bunch of mail. So no matter who you signed up for, whether it's a Humana plan, United, Care Plus, Aetna, whoever, you're going to get a bunch of mail from those providers for the plan that you selected moving into 2021. So look inside those documentation and look for important numbers for all the different services that your plan provides. So if you use transportation, you want to make sure you have the transportation phone number. You may want to have the Silver Sneakers phone number for those that may use those type of benefits. Maybe you haven't received your 2021 Silver Sneakers card. So look for those contact numbers, your transportation number, your rewards programs numbers, any particular programs that you used to having in the past. You want to make sure you have the most updated numbers moving forward for 2020, and those will be located inside your plan documents. Last, as we close out, one big question I normally get is, hey, can I switch, right? Maybe I missed the deadline for annual enrollment period, or maybe I think I made a mistake. When can I switch, or can I switch? Okay, well, typically what happens is from AEP, you have that opportunity to make a plan change from October 15th to December 7th, okay? And so for the most part, most people are locked into their plan unless they have a special election period. So you may be locked in until the next enrollment period. So there are a couple of opportunities that you may have a chance to make a plan change or switch. Number one, you can switch into a 5-star plan in your area at any time. So if there's any plans out in your area that's listed that has been rated as a 5-star plan by Medicare or CMS, then you can enroll in those plans at any time during 2021, okay? If you have low income subsidy, also known as LIS, which is offered through Social Security, it helps kind of keep your medicine costs down. Or if you have state Medicaid along with your Medicare, then you can make a quarterly change, all right, from one plan to another plan using those special election codes. Now, for all others that may not have a 5-star plan in the area, or maybe the 5-star plan in your area does not have your doctors and network, there will be a small window of opportunity between January 1 and the end of March, March 31st. There's a small window of opportunity that you can change from like plan to like plan. So if you have a Medicare Advantage plan and maybe you're unhappy with your selection, or maybe that you missed a deadline, or just you just were confused. I know how it is. You're bombarded with a lot of information during that time. You do have a small window of opportunity from January to the end of March to make one more change. Okay, and so that is a window of opportunity for those that do not have low income subsidy or Medicaid benefits, or you do not have a 5-star plan in your area that has your doctors in network or what have you. There is that small window. So don't wait to the last minute. So that's why it's very important to get around and start mixing up very early to catch any glitches, any things that you were not aware of in your plan. Like I said earlier, doctors moving in or out of network, cost of medicines either not being covered, or the cost is a lot higher than you expected or more than you paid last year, right? Any type of glitches or last minute surprise that you may incur, you have that small window of opportunity. So guys, we appreciate you trusting in us to help you with your healthcare services. If you need any type of other benefits that we may be able to assist you with, such as a stronger dental program, reach out. We have quite a few different options that you can get at affordable prices, or just have general questions. Feel free to reach out to me at 904-338-8171. So as we transition from 2020 to 2021, I want to wish each and every one of you a happy new year. Stay blessed.